Welcome back to The Educated Associate, where I continue to share valuable tips and insights that are applicable to new or associate dentists. In today's episode, we'll discuss how to effectively complete a new patient exam in under 30 minutes while also making the patient feel special. We'll explore techniques to build trust, communicate effectively, and address dental anxiety. There's always a lot to talk about, so let's get started. Segment 1 is going to discuss building trust with the slow warming technique. Building trust with your patients is crucial, especially during that first visit. In one of my previous videos, we discussed talking with your patients about anything and everything non-dental for at least the first few minutes of their appointment. This immediately will bring them into a relaxed environment that they're not accustomed to in the fast-paced nature of most healthcare visits in the modern world. By taking the time to introduce yourself, engaging in just friendly conversation, and actively listening to any of their concerns, whether dental related or not, will help you establish rapport. If you do this, you'll create a foundation of trust and it will make the patient feel at ease. Personally, I like to use this slow warming technique to try and learn one or two things very unique about each patient. Do they love to travel? Are they currently planning a trip to Greece? Did they just get back from Greece? If so, I make note of this and I try and bring it up at future appointments. This shows the patient that you were actively listening to them, and if they know that you were listening to their non-dental comments, just think how much they think you're thinking about their actual dental concerns. Segment 2. After you've warmed the patient up with that slow warming technique, talking about anything non-dental, I like to use metaphors or understandable language when talking about anything related to dentistry. As we all know, frank dental jargon is overwhelming to our patients. In order to help them better understand their oral conditions, utilize metaphors or relatable language. This will allow you to break down complex terms into simple explanations that resonate with patients' everyday lives. This approach will promote understanding and promotes a productive conversation that empowers the patients to make an informed choice about their dental health. Personally, I use metaphors all the time. In almost every new patient interaction, I will use metaphors. I will talk about their periodontal condition, juxtaposing it to the foundation of their house. I talk about periodontal disease, building a house on a sand foundation, while a healthy periodontium would be like building your house on a 2-foot slab of concrete. Which one would you rather live on? I now live and practice in Tempe, Arizona. This area of Arizona is well known for its year-round golfing. I will talk about periodontal probing depths like a game of golf, and by that, I mean the lower score is better. It's almost the only sport where the lower score wins, and that resonates with a lot of the patients here in Arizona. Providing clarity for our patients on complex topics like periodontal disease using relatable facts or metaphors has greatly increased my patient acceptance of suggested treatments. I have known that when I use metaphors, it significantly decreases the length of time it takes for me to convey my message. So in a sense, using metaphors or lay speech will actually speed up your dental visit and will increase your case acceptance. It's a true win-win. Segment 3. Asking how you can help. As a new associate dentist, it's important to let your patients know that their needs are your top concern. During the exam, I like to ask the patient very directly how I can help them. By actively involving them in the conversation, you establish a patient-centered approach that demonstrates your commitment to addressing their needs. One of the worst things we can do as a provider is fail to address the patient's chief concern. Even if the patient wants to talk about whitening while they have a mouthful of cavities and poor periodontal health, it's still your responsibility to always address their chief concern. Sometimes you can just sidestep their concern by saying something like, "We certainly want to talk about whitening your teeth, but you currently have some cavities and other gum issues, and if we want your teeth to be all appearing the same color, we'll want to wait and whiten after we address these problems first. If you want to keep your teeth healthy and looking beautiful, I would suggest you do this here first before we consider our whitening options." Other times, the problem that's being brought up should be addressed right there in the appointment. For example, if a new patient tells me that they chipped a front tooth, I will do anything and everything I can do to try and fix that tooth for them that day. Whether this just means smoothing an edge or adding some resin, or even if it means preparing for a full coverage, I will do anything to fix anterior teeth problems that same day. This has been a huge practice builder for me. At the end of the day, I have found that asking patients very directly how I can help them is the best way to find out what their true chief complaint is, and it also ensures that I address that chief complaint. The next thing you can do to get through a new patient exam quicker is address their dental anxiety. Again, this might seem counterintuitive to bring up dental anxiety while you're trying to speed up the new patient exam. However, I found that by directly addressing their dental anxiety, we're able to, again, have an open conversation and create an opportunity for patients to discuss past experiences that were not so enjoyable for them. I found that when a patient in that first visit gets to open up about their anxieties and share with me things that happened or things that they didn't like that happened, I am able to better manage the patient going forward. I will often straight up ask the patient what I could do to better help them get through their dental treatments. For some people, this means more breaks throughout the treatment. For other people, this means explaining everything very, very closely. For a third group of people, it means explaining almost nothing at all. By asking the patient what works best for them, I will ensure that they get the type of treatment that's best for them, and at the end of the day, will make my dental treatment more successful. At the end of the day, completing a new patient exam in under 30 minutes requires effective communication, trust building, and addressing any dental anxieties, and always making sure we know the patient's chief complaint. By using a slow warming technique and talking to our patients about anything non-dental related, we make them feel comfortable. We then use metaphors and understandable language to help them understand their dental conditions. At the end of the visit, you should be directly asking the patients about any dental anxieties and how you can help them going forward. This will create a patient-centered approach and provide the best overall experience for the patient, and they will leave your dental visit knowing that they're not just a number on your chart, but they're a patient in your heart. Thank you for watching another episode of The Educated Associate. If you found this video helpful, slam the like button and subscribe to my channel for more valuable information. Again, know that knowledge and continuous learning are the keys to success. So be ready for another episode next Monday. If you have any questions, you can reach out to me directly at theeducatedassociate.com, or you can find more information tailored to associate dentists on my Instagram or Facebook at The Educated Associate. Let's keep growing together, and as always, stay drilling, my friends.